Thank you very much. I want to thank Motion and Dr. Maka for inviting me to speak with you this evening. And thank you all for everybody who's come by to visit me already. It's been very nice chatting with you. So I'm here to talk a little bit about microneedling for the treatment of acne scarring. So I got talking to a number of you tonight already. I gather that a lot of you are already using microneedling or already familiar. So some of this will be review, but I've got some really good slides that I think you'll enjoy. So just to review, microneedling has been used for many, many years. But in the last 20 years, there's been a huge evolution in the technology that's used. So just like to review some of that technology. Talking about, we'll just talk generally first about what microneedling is designed to achieve. So microneedling involves the use of tiny needles that create microchannels in the skin, eliciting a response by the body, causing it to generate healthy new tissue in the affected area through the three phases of wound healing. First phase being injury with some inflammation, and the second being tissue proliferation, the third tissue remodeling. And this is where we get the growth of healthy new collagen deposited into the site where the injury occurred. As I said, there's been a great evolution over the last few years. Originally, the concept of microneedling originated back in 1995. The original premise was using subcision technique, using a needle to release scar tissue. Later, a technique called needling dermabrasion was performed using a tattooing device to release tension and tightness of tissue caused by scarring. This was very labor-intensive due to the nature of the device, but both techniques demonstrated what was the development of new connective tissue, this wound healing. So this again shows some of that the process of the evolution, if you like, of devices. Some of you may be familiar with some of these rolling devices. Stamps and rollers were widely available but minimally regulated, not easy to effectively sterilize, and especially those that were being used by patients at home. So as cross-contamination damage to skin became of greater concern, newer technology entered the market, including the device we are now representing in Canada, SkinPen, which became available in 2013, and their newer innovative product, which has now FDA clearance, available in 2018. This really is the most exciting evolution in microneedling in 20 years, because it is the first and only U.S. designed, engineered, and manufactured device, not only offering a level of quality and reliability previously unseen in the microneedling pen market, but also offering clinically proven safety and efficacy, and the only microneedling device with the medically indicated for acne scarring and melasma. I'm just going to skip through this, sorry. So, as I said, we're going to do some slides now showing the benefits of microneedling for acne scarring. It's FDA and Health Canada approved as a Class 2 microneedling device, and I will reiterate, it is the only device with medical indication for acne scarring and melasma. So, using a microneedling pen for acne scarring. So, as you can see, they've done a number of different validation studies, 90 in effect. A single-center clinical trial was conducted to assess the safety and effectiveness of a microneedling pen, it had to be SkinPen, by treating adult men and women of all skin types with acne scars on the face. These subjects were provided 3 skin pen treatments spaced 4 weeks apart, followed closely to report treatment responses and adverse events. In the end, the clinical trial provided clear evidence of results, patient satisfaction, and successful treatment of facial acne scarring, with the majority of patients providing really high scores of levels of satisfaction. So as I said just now, high levels of patient satisfaction. But in addition to being effective and well tolerated, we see 90% of the clinical trial subjects reported an improvement in the appearance of their acne scars at the end of the 6-month trial, 6 months post their last treatment, sorry. This statistic was an increase from the 1-month survey where 80% of subjects noted an improvement. So this data helps demonstrate the early high patient satisfaction ratings when using microneedling and the importance of completing 3 treatments spaced 4 weeks apart. So most of you...
Sorry, question. How deep are you going into the skin?
So with acne, so if it's facial rejuvenation, because obviously microneedling is used for facial rejuvenation, lines and wrinkles, depending on the area of the face, usually we're talking about 0.25 to 0.5 millimeters around the eye, forehead, usually 0.25 to 0.5 with our device. For acne scarring, you're probably going to want to go up to 1.5, and depending on how severe it is. You never need to go more than 1.5 millimeters on the face because the dermis isn't anything to our device and most others as well can be dialed to a depth of about 2.5 millimeters. But obviously that's for using in other parts of the body, scarring on other parts of the body, for example. So at the conclusion of the trial, subjects, as I said before, subject satisfaction was very high. You can see these pictures speak for themselves as before and after pictures. And I was talking to somebody the other day who shared with me that as much as we talk, obviously microneedling is collagen induction therapy. We're trying to produce collagen. But what people are seeing is that treating patients with acne, their acne actually is improving. We don't usually recommend microneedling with active acne, pustular acne, but some people do. But so patients are seeing improvement in their acne aside from correcting the scarring. So this is just reviewing, just emphasizing the satisfaction level of patients having microneedling treatment for their acne scars. So you see a reduction in not just in the depression, but in the redness as well. This is another chart just reflecting the results in the study. So the treatment, response, dryness, rough skin tightness, the side effects that we might expect with microneedling. You can see the downtime. We talk, you hear about patients not wanting to have a lot of downtime when they're having their cosmetic treatments. Well, microneedling downtime is, 1 day if that. They don't need to stay home at all. Certainly with skin pen, any redness is pretty much gone by the next day. So just reviewing the patient experience. What's important to you when you are recommending treatment to patients? You want your patients to have a good experience and be happy with what you've done. Why do so many subjects recommend skin pen at the conclusion of the clinical trial? Perhaps it was positive outcomes from the microneedling experience. But what's important to you when recommending treatment to your patients? Anybody? When you recommend a treatment, what's important for you to hear? No? You want them to be happy, yeah. Well, let's walk through how to administer a skin pen treatment and what patients expect. Just quickly. So one wonderful aspect about microneedling is it can be used for any skin type. There's no heat generated, so there's no concern about hyperpigmentation from if you're using a heat-based device. So it can be used on all skin types, any time of year. It's performed efficiently, effectively by this typo there. Should be a professional or medical professional or medical professional assistant. And it's very comfortable for the patient. This gives you an idea of what, when we're talking about downtime, you can see, 1 hour post-treatment is quite a bit of erythema, but 24 hours later, most of that has already dissipated. This is a very important point. When we're talking about acne scarring or facial rejuvenation, textural improvement, we are talking about collagen, inducing the production of collagen, and as much as we talk about 3 treatments spaced, a minimum of 3 treatments spaced 1 month apart, for acne scarring, it may be, some people may need as many as 6 treatments, but for general facial rejuvenation, 3 treatments a month apart. What's really, really important to maximize the benefit to that patient and collagen production is for them to be using the appropriate skincare, to be giving the skin the nutrients it needs for optimal collagen deposition. So that that usually minimally includes a vitamin C and a retinol. There's others nice to have products, but a vitamin C and a retinol, and of course an excellent sunscreen to protect are the minimum. But you can see, we go through, we talked about the 3 phases of progress. So the first phase is that inflammatory phase. We want that to be minimal. There's no need with microneedling. You see images on YouTube, etc., of the face all inflamed, a big bloody mess, There's no need for that. We don't want, having excess inflammation is not the goal. Inflammation results in aging, is damaging. So there's a number of features I've spoken to a few of you about with this new device that we have, where the needles on this device are the highest quality stainless steel acupuncture grade needles, perfectly smooth to cause minimal damage. So we want that inflammatory phase to be a minimum. Second phase is proliferation, and that third phase is remodeling. This is what takes months. And this is where it's really critical for the skin to have the nutrients it needs.
I was told that the average depth you want to go is about 1 millimeter. Is that?
It depends on the individual.
But what you're talking about, sometimes if you go deeper, it causes too much inflammation.
Well, the goal is not to cause excessive inflammation. The end point is just an even erythema, such as if they've had a sunburn, not sunburn. Okay? You might find patients will come to you and they're expecting to have a lot more, look like they've had a lot more trauma. I think a lot of that comes from what people see in social media. That's not the goal. That's not necessary, and that's harmful, in fact. So we can get into how to do the microneedling treatment. That's another conversation. But the end point is even erythema. However, for acne scarring, you are going to want to double down on that in that area, go a little bit deeper. And those patients may need more treatments. So you can't say the average for anyone. You judge it per patient. Okay, post-treatment goals are to maintain a moist, breathable environment, supply key nutrients, and avoid inflammation. And this is where I was talking about the nutrients necessary for skin for optimal collagen deposition. Sure. I'm just skipping through this. So again, this is post-treatment. As we discussed, certain ingredients are necessary to consider post-microneedling. We should also discuss ingredients we know to avoid post-microneedling, certain things you don't want to be using. Watch out for preservatives, sulfates, glycols, silicones. Want the skin to breathe. Dyes, fragrances, anything that might be If any of you have spoken to me about what we have to offer, you'll see that FDA, we have a little treatment kit. It's not just the cartridge on its own. It's a treatment kit that contains everything necessary post-treatment and for the treatment. And it's actually recommended that nothing be applied to the skin while those microchannels are open. At least for the first 24 hours, unless it's something that's approved specifically for microneedling. So I've spoken to many experts in this, and they all say nothing for the first 24 hours. There was a study in 2014 where they looked at patients that had developed granulomas from just using hyaluronic acid and vitamin C post-microneedling. And yet a lot of companies will recommend using hyaluronic acid as a glide for the treatment. When Bellis was developing skin cream, like I was telling some of you, they worked 3 years with the FDA. It took 3 years to develop a product that would meet the FDA standards, and FDA did not recommend using hyaluronic acid because of that study in 2014. To determine if microneedling is right for your patient, I'd recommend choosing definitely a Health Canada approved device. There are many out there. I see them all the time going into a clinic that are not Health Canada approved. And as I said, we have the only FDA approved device. And many of the devices that are even Health Canada approved are not legal for sale in the US. And that's because of the level of the added safety benefits, all designed to diminish the risk of cross-contamination. And definitely PRP is used a lot for acne scarring. I've been meeting with a lot of people lately that are buying microneedling to go with their PRP. They're using it for their PRP treatments. So, one doctor said to me, why would anybody use any other device when they're using PRP, other than this one that has the highest safety standard, all to do with eliminating the risk of cross-contamination. So there's a lot of features built in, and when you've got that much plasma, we're not just talking about a little bit of pinpoint bleeding, you've got a significantly more risk when you're using PRP. So, for your acne scarring patients, for your facial rejuvenation patients, using microneedling offers very high patient satisfaction. It could be used for all patients, all skin types. It's minimally invasive and little to no downtime. Is microneedling right for your practice? It's a gateway technology. So I also talk to a lot of people about, if they're doing facial rejuvenation, they may not be focusing on the acne patients, and this was mentioned earlier by Dr. Archer. As much as we don't like to think, we like to treat the patients for the good of the patients, but we're also in business. So forgive me, but I talk to a lot of people, I say, that's a whole area where you can really grow your business by promoting or talking about the fact that you offer great acne treatments, and you don't have to. You can do this with a fairly inexpensive device and with skincare and chemical peels. So it's a gateway technology, meaning that it's an relatively inexpensive expenditure and inexpensive treatment for your patients, which will lead them to more expensive treatments when you have those to offer, or more like CO2 laser. They need that kind of treatment. You're going to advance them to that down the road. It integrates easily into any practice and patient treatment regime, and also helps develop long-term patient retention. We like to say this device protects your patient and protects your practice. You can imagine in the U.S., they're very litigious in the U.S., so that's a really high priority for them. It's very profitable and generates great referrals. It's warranty-backed, and I was just talking to some of you about a new warranty program that we're just implementing, a lifetime warranty on the device with certain volume of treatment kit purchases. My last slide, as I just kind of mentioned, is more about microneedling as a benefit to your practice. We talk about doing a minimum of 3 treatments. We would suggest a price of, if you have 3 new patients, 3 new patients a week, even at $350 a treatment, which is a reasonable price for a microneedling treatment. Treat with a series of 3, that's $1,050 for a series of 3 per patient. So this is something you can easily integrate into your practice. Get your, some of you, I've spoken to tonight, are just getting started in business. So this is like I say, a gateway treatment with huge benefits for your patient. You can generate huge satisfaction, as I showed you in the studies. Very high patient satisfaction with their treatment of acne scars, without mentioning facial rejuvenation, lines and wrinkles, the other benefits of microneedling. So that's the last slide. Does anybody have any questions?
I missed why you said that hyaluronic acid is not good for...
Pardon me?
I missed why you said why hyaluronic acid is not good for post-treatment.
Well, the FDA discouraged, this is an American brand, like I said, they spent 3 years working with the FDA to develop this product so they would have FDA approval. And FDA discouraged them from using hyaluronic acid because of a study back in 2014 where there were instances of granuloma with when that's hypoxia and microneedling. So they have a statement saying that this device is not to be used to microneedle compounds into the skin, unless they're approved for that purpose. And we have a hydrogel, just a hydrogel that is used for the blind. Otherwise, people are using PRP as the blind, and then applying the hydrogel on top of it.
Thank you.
Is anybody using microneedling currently for treatment of acne scars? And you're seeing really good results? Yeah. No. Thank you. Right. Yeah, so, obviously we have a feeling why we would recommend skin care. But yeah, microneedling, this presentation is talking about microneedling in general. So very effective treatment for acne scars. Dr. Artest mentioned Bellafill. So what a lot of doctors will do is use, or the nurses will do is do the microneedling series of microneedling treatments first, and then, if necessary, use some Bellafill, which is microneedling so they're using minimal amount.